Dr. Geetha Ramaswamy, who would be talking about mental health benefits from yoga. Dr. Geetha Ramaswamy is a psychiatrist who received her medical degree from Mysore Medical College in India. She completed her psychiatry residency and fellowship at the University of Cincinnati. She practiced as a clinician treating patients with Alzheimer's disease and other cognitive and psychiatric disorders for over more than 2 decades in the Cincinnati area. She then worked in the pharmaceutical industry for a few years in the area of Alzheimer's disease, bipolar, and other psychiatric disorders. Having said this, I would hand over to Dr. Geetha Ramaswamy. Over to you, Dr. Geetha.
Hi. First of all, I want to thank you all for doing such a wonderful event. I was listening to some of the speakers yesterday. Amazing. It has been a learning experience. And I think this whole event is amazing, that it's a unifying event that is bringing people globally together for something that is a very good cause. I'm a psychiatrist, as you mentioned, and I want to focus on the mental health aspects of yoga. Again, a lot of research has been done by experts all over the world. And what I was trying to do is kind of simplify the message and maybe try to talk about how I understand the neurophysiology behind the potential benefits of yoga. So yoga, mindfulness, and meditation, what do they actually do? They bring us to our basic equilibrium. And by that, I mean, we can be ourselves once again. And this is so important in this today's world where we are so busy and surrounded by hostility and anger and everything in the environment. It is an experience of your inner self. So that is your best self, in your inner core strength. You can feel your inner joy, your inner radiance, your inner vibrance. And we get back to how we felt as a little child, how a baby feels in the mother's arms. And there's no comfort to beat that. And as a psychiatrist, I can say no medicines in the world can bring us to that level of equilibrium. And of course, we need medications for disorders, but I would say that the basic thing is to get ourselves to who we are. That is such a beautiful feeling. And I don't have to talk to you all are practitioners of yoga. So and meditation, when you feel that inner self, you don't want to let it go. And that is the kind of equilibrium you want. Now, how does yoga, meditation, mindfulness achieve that? The simplistic way of understanding that is it affects a specific part of our nervous system. So we have an autonomic nervous system in our body, and I'll keep it simple. It is parasympathetic and sympathetic nervous system. What does that mean? The parasympathetic nervous system is the nervous system that is involved in rest and restoring. Like after stress, it brings your body back to that. And how does it do it? It decreases your heart rate. It slows down your breathing. It lowers your blood pressure. It actually restores you in many ways. It conserves energy. And it actually can promote improving your immune function, can decrease stress and anxiety. So that is how we want to be 24 hours a day, if that's possible, but it's not. And yoga and meditation, mindfulness bring us to that. And as you can see, when we practice yoga and meditation, you do it in a quiet environment. So naturally, you have less external stimuli, the external noise we have at the TV and the people speaking, talking around. But also we have internal peace. So the internal chatter goes away. So your mind is not racing. So in disorders such as bipolar disorder, we describe racing thoughts and flight of ideas. What does that mean? These patients have thoughts that go so fast and they want to say so much. And you can see the discomfort they feel. So what we can say, if you bring our own equilibrium back, we're not tending towards disorders such as that. The opposite of that is sympathetic nervous system. So sympathetic nervous system, it actually does the opposite. It increases your blood pressure, your heart rate. You can feel you're sweating, you're breathing faster. It's causing stress all over. So why does that sympathetic system even exist? It is existing for a reason. It is a protective mechanism that should act only in times of stress. So say in this room, there's a tiger, unless you're a Tarzan, you want to run away. Or if there's an avalanche or a tornado, anything like that, a very difficult situation, then the body is actually helping you. So it braces itself and brings it to the maximum. So the heart rate is going fast. It's working efficiently. That's what it's trying to do. You're breathing fast and you can feel sweaty palms. You can feel your blood going down to the feet and you can feel your leg feeling like noodles. People even feel they have a heart attack because the muscles become tense. So these are this should come into play only when there's increased stress. And so it's not on a daily basis. It should happen only in extreme situations. But what happens is, in terms of stress and anxiety, when you're already prone to that, the brain is actually thinking differently. The prefrontal cortex is the part of our brain which is the thinking portion. When it gets a little confused or it's overwhelmed, it switches to, I think some of the doctors yesterday referred to the amygdala. It's a small portion of our brain, but very important. It controls emotions, especially fear. So when the prefrontal cortex is not knowing what to do, it as the amygdala, it sets off an alarm, and that goes into action. When that goes into action, it sets the sympathetic system, what we call as a fight-flight response. And the fight-flight response is exactly what I described. You flee from something or you fight back. And that mode, you can even imagine what we're doing to ourselves if we are in that mode, almost the waking hours of the day. And that is what is happening these days. So you can look at our environment. And this is the best time to have a conference such as this, because I think it's not only a pleasure to have it, it's a necessity. Because globally, you can see there's animosity, anger, hostility. You get up in the morning, turn on the TV, you have negative news. And the social media, I think, is the worst enemy we have them. People are always talking negative. It's meant to be a communicating platform, but what we do is people are hostile. And there's a intense need to win over other people. So in the former world, only experts talked about their field. Now everybody's an expert, whether they know it or not, and they want to be one up over somebody else. So there's always a competition. Life is not a competition. I mean, we can see even from the past 2 days, there are experts in every field, and we have only scratched the surface. So we all are experts in our own way, and we don't have to be experts. I mean, the sense of urgency, competition, coming one, that is good for performance, but it is not good if everybody's urging to do that at the cost of making other people feel bad. So anger turned inwards is the main cause of depression. So as you can imagine, there's anger in each and everyone today, instilled by different things. That actually hurts us more than anybody else. Similarly, lack of self-esteem and self-worth. There's always, people are barraging others, their judgment, condescending remarks. When you break somebody's self-esteem, then obviously you get depressed. So we are talking about psychiatric disorders that are instilled by environmental factors. Things like yoga, meditation, mindfulness. These are amazing in that they trigger what I said, the parasympathetic nervous system. So your heart rate is slow, you're breathing slowly. It's as simple as that. So you can bring it just by doing diaphragmatic breathing, which we all know, abdominal breathing. Just try that for a couple of minutes, and the happiness you get from that and the feel, you will never want to let it go. So it's very therapeutic in nature. Now, what I worry about is not even adults that we are on this conference. We have some coping mechanisms because our childhoods were not like this. So we would go out and play in the backyard. We would, talk to our neighbors. No, it's not that. Our children, from the minute they wake up, they look at the social media, they go on a bus, there's a fight in the bus. There's a fight when you get off the bus. The teachers and parents are fighting. The school board and the parents are fighting. And in the class, there's all about, there's so many reasons. I'm not getting into the political environment, but it's just very negative. So you can imagine how the parasympathetic system is not working. Sympathetic is in high drive. So this generation of children, when they grow up, I just don't even want to imagine what that will do to us. So what can we do? We need to address these situations. So one of the things we are recognizing a lot of ADHD. The ADHD, or attention deficit disorder, is a real disorder where people can't pay attention or focus. And why does that happen? There's less dopamine. Dopamine is a neurotransmitter in our body, which actually regulates, and it is important for pleasure sensation. So dopamine is what helps us feel happy and pay attention. It works again on the prefrontal cortex. Studies have shown that in ADHD, attention deficit disorder, there's thinning of the prefrontal cortex. So that you are actually affecting your brain. So it is a real disorder. That said, I think everyone, even on this call, is multitasking. So our life is that. So when you complain about lack of attention, I mean, how else would it be? Because you can see multiple web browsers open in everybody's computer. And if you're watching television, you're not satisfied with one, you change to another channel. And I used to take pride in multitasking, and I'm guilty of that myself. I realized that while that is an efficient way, being a mother, holding a carrier, life, all that stuff. But what is it doing to us? We're not doing anything properly. So that focus is gone. And if we say there's ADHD diagnosed, overdiagnosed, underdiagnosed, I'm not surprised. Unfortunately, a lot of young kids are getting put on medications just as an answer. You go to the doctor, a pediatrician will do a scale, or even young adults, they're getting diagnosed. I'm not saying they are all inaccurate, but is that the first step to go for medicines when we may have other resources? So let us look at things like yoga and meditation. So the other disorders that I want to touch on, being a geriatric psychiatrist, is Alzheimer's disease. Now, I'm a cognitive specialist in that area. That was my specialty. It's a devastating disease. And I think every one of us has had somebody we know, a friend or family member, who has Alzheimer's disease. Unfortunately, there's no cure. Even I worked in that area for several years hoping for a cure. We do not have a cure. We only have medicines that may slow down the progression potentially. And why I talk about that is, even for Alzheimer's disease, yoga might have some benefits. Because what happens in Alzheimer's disease, your neurons are dying, the interconnections, what we call as neuronal plasticity, that is the ability to connect neurons, is lost. And yoga can be restoring in that way also. Yoga helps the neuronal synaptic plasticity, so the connection between neurons can grow. So there's a physical evidence that yoga can benefit even in cognitive disorders. So lastly, I just want to say, we want to do activities such as yoga, meditation, mindfulness, and bring ourselves to that inner peace, our best selves of ourselves, inner vibrance. And if each of us spend some minutes a day to do that, the society as a whole can be very different. And I would thank this, because Vijaya actually, encouraged me. I'm guilty of not participating in this before, and I feel it's a loss that I have not. And I really, really thank her for all her efforts and encouragement. I'm hoping that we can reach millions of people and teach yoga and the benefits, mindfulness, meditation, and if nothing else, just the concept of let us all be our original, calm, happy inner selves, even for a few hours a day. I think that will change. Unit by unit, we can change a family, we can change our society, we can change globally. Thank you so much.
Thank you so much, Dr. Geetha. It was an excellent talk, I should say. I mean, you addressed the very practical aspects of what's going on in the society these days, and how we have to make a change. We are forgetting, with all the technology that we have and all the race against time, we are forgetting what humans are supposed to do. We are supposed to socialize, we are supposed to stay calm, we are supposed to take some moments for ourselves, for our own good, as well as to help our family and society. So that is exactly what we try to tell every yoga session, how we have to be one with ourselves and be able to practice yoga for the bigger good. Thank you so much for emphasizing on that as well.
I just want to touch on two things that I think if we can be, and it's irrespective of yoga or others, the compassion,
correct,
the empathy we can have for each other, and being non-judgmental. So spend yourself time with people who make you feel good. I think that is the best therapy. Of course, there's room for medicines, and we can have sessions talking about individual medications. But I think the restorative yoga, it restores us, it brings us back. So let us instill some compassion, empathy, and humanness in each and every one of us. Thank you.